Okay, our doctor has ordered an IV push of morphine for our patient. We're going to check our drug reference for information that we need to give this. We're going to check the accuracy of the MAR to what we're giving. We're going to check the expiration date of the medication, compare the medication label with the MAR, and I want to prepare my syringes with the medication. So we're going to wash our hands. Get some gloves on, and again, make sure that it is not expired. This is our flush. Vigorously, 15-second clean. And we're going to get 6 mils. It's all right if you get more, but get at least 6 mils. Or 6 mils. And there's a little bit more in there, but that is okay. So that is our flush. We're going to draw up our medication. And again, we have to clean the diaphragm, 15 seconds. And the order is for 2 milligrams. The bottle has 2 milligrams per milliliter, so I'm going to draw up 1 milliliter. We have 1 ml in there. Now, the drug book states that we need to dilute this with at least 5 milliliters of diluent. The diluent we can use for this is normal saline. So I'm going to draw up some normal saline. "15 seconds. I don't want to use the same needle. I don't want to contaminate the diluent, so I'm going to change my needles out. Give a little air space so we don't contaminate or accidentally pull up any solution into the diluent. And I need to pull up 5 milliliters. So I had 1 in there, so I know I want to have 6 milliliters of fluid. So I have my 6 milliliters. And it's hard to tell the difference. They both have about 6 milliliters, so I've already put tape on this syringe, so this is going to be my medication syringe so I don't get them mixed up. So now I'm going to go into the patient's room. I'm going to check their ID with 2 identifiers, their name and their birthday. I'm going to ask them if they have any allergies. I'm going to ask them if they understand what this medication was for. Have they had it before? Are they okay with taking it? Remember, they have the right to refuse. So again, I'm going to perform hand hygiene. I'm going to put gloves on, and I'm getting ready to do this push. So I want to inspect the IV site, making sure there's no signs of infection, phlebitis, and I'm going to clean that hub. So 15 seconds again. Okay, and I take my flush, and I'm going to flush 3 mils in here. I'm just making sure that whatever might be in this hub is now flushed free. I also want to make sure that the line is patent. So I'm going to put in 3 milliliters. We got our 3 mils in, and it went in fairly easy. And I'm going to get ready to give my push. I'm going to clean my hub again. And I am going to push the medication. The book says that I need to push this in 5 minutes. So I have 6 milliliters. If I do it a minute a milliliter, it'll take 6 minutes, and it's okay to go slower. So I'm going to actually do a half a milliliter every 30 seconds. So a half a mil, as I'm looking here. A half a mil, wait 30 seconds. And I'm going to push another half a mil. And we're going to continue that way until we get all 6 milliliters in. And then we're going to clean the hub again. And I'm going to flush. And this is really important to remember, that your final flush has to go in at the same rate that you push the medication. I still have this much medication waiting to be instilled, and I don't want to just push that in as fast as I can and have that go in too fast. So remember, I have 3 milliliters left, and so I was doing a half a milliliter every 30 seconds. I want to continue at that rate. So a half a milliliter, 30 seconds. And then another half a milliliter, wait 30 seconds. I will get this all infused with the person. When I'm done with them, I want to make sure that I ask them if they're feeling okay, look for any adverse reactions, make sure I evaluate the efficacy of the medication after administration, come back and see for this person, has their pain been relieved, and then I'm going to record that I gave this med on the MAR.